audiology and speech perception. His research contributions include multiple publications in reputed national and international journals, also authored author chapter. Through his academic, clinical and research contributions, Mr. Saravanan continues to actively support advancements in audiology, hearing sciences and auditory diagnostics. We are honored to have such a dedicated and accomplished professional among us. On behalf of Organizing Committee, I warmly welcome you, sir. Now I request you to take over the session. Over to you, sir. Thank you.
Hearing loss or hearing impairment, and what are the causes for it, why the person get hearing loss, and what are the effect of that. Once the person get hearing loss, what will be the consequences of that, and how to correct that, and how to go for a treatment of that. So hearing is an important sense because hearing helps us to hear and helps us to communicate. Very important sense. So if a person is unable to hear, then the person is having hearing loss. Okay. So if a person is having hearing loss, it can lead to other consequences. Like in case of children, it can affect their speech. Okay. Because we learn speech by hearing. Okay. So if the person is having hearing loss, then eventually it will lead to problem in speech development. Okay, they will not be able to speak normally. Okay. It can affect also overall quality of life. Okay. In case of adults, it can affect their communication, their employment. Okay. Because hearing is very important for the communication. So hearing loss often mentioned as invisible disability because you don't see anything as an outside. There is some deformity or any which we can see and identify. It is more of invisible disability. Okay. Because it is structurally normal, only the function is affected. So the person is having hearing loss. Unable to hear, then he is having hearing loss. So it is called invisible disability. Okay. So I will just take you through some statistics of how prevalent it is, this condition. So according to WHO 2021, you see over by the year 2050, you will have 700 million people having hearing loss. 1 in every 10 individuals will have hearing loss. Okay, so that is a huge number. So currently, over 1.5 billion people, around 20% of the population, are affected with hearing loss, and majority of them have mild hearing loss. So I will talk about different severity of hearing loss. So the severity can go from mild to the profound hearing loss. That is the highest severity. Then 430 million, that is approximately 5.5% of the global population, have moderate or higher degree of loss. So they require hearing intervention. They require some kind of intervention. Okay. So without that, they will not be able to manage. In this, nearly 80% of the people have disabling hearing loss, mainly in the low and middle income countries. And it's more prevalent in the older population. Okay. Generally, older population, you will have 1 in 4 adults over 60 years will have some kind of hearing loss. Okay. So yesterday you would have learned some basic the functioning of the ear. Okay. Our ear is divided into 3 major sections: outer ear, and we have a middle ear here, and the inner ear. The coil-like structure is the inner ear. So this outer ear and middle, the role of outer ear and middle ear is conducting the sound. The sound is there in the environment, it is conducting the sound to the inner ear. So this outer and middle ear also called conductive mechanism. The main role is it just conducts the sound. So sound passes through the outer and middle ear and reaches the inner ear. The inner ear, what we see a coil-like structure, so that is called called sensory structure or sensory mechanism. So that is the structure that sends the sound. Okay, that sends the sound and send the information to the brain for understanding. Okay, so that is very important because all the sound is being perceived from the inner ear, then the information is sent to the brain for understanding. Okay. I'll just briefly talk about, you would have already learned this. The sound is passing through the outer ear. You have the ear canal like a tube-like structure. Sound passes through that. End of that you have a eardrum. Okay, it is like your diaphragm in the microphone. Okay, so very thin membrane that vibrates for the sound. That vibration is conducted through the bones in the middle ear and reaches the inner ear. Okay, so middle ear is a air-filled structure. It is filled with air actually, and your inner ear is a fluid-filled structure. Inside there are fluids are there. Okay, so sound is going from outer ear, then through the bones it reaches the inner ear. Okay. So after reaching the inner ear, there is a vibration. Okay, that vibration is conducted to the inner ear, and it will also cause vibration inside the inner ear, inside a membrane called basilar membrane. So that is a sense, that is very important structure where all the sounds are perceived. Okay, so this basilar membrane vibrates, and in the basilar membrane you have something called tiny cells. It's called inner air cells and outer air cells. Okay, you have outer air cells and inner air cells. So these are two very important structures. Because these cells are only important. If these cells are damaged, the person will have hearing loss. Okay, so these sounds, these cells take this vibration. These cells act as a transducer. It converts the vibration into electrical signal where the neurons or nerves can conduct that to the brain. Okay, so it acts as a transducer. Okay. So in the basilar membrane again, the entire length of basilar, if you just uncoil that coil-like structure, if you just stretch it, you will have a structure like this. So this is the basilar membrane, and each location in the basilar membrane is responsible for particular frequency. It is like a piano. So each key has a different tone, note. Similarly, each location here is responsible for different frequency. Okay. So here it is responsible for very low frequency, then mid frequency, then towards here it is high frequency. Okay. So our hearing can expand from 20 Hz to 20,000 Hz. So we have a very wide range of hearing. So the cells are very important, I mentioned. So mainly the outer hair cells, it acts as an amplifier. Okay, it's a natural amplifier. So it helps to detect the softer sound. The person, somebody, we know that sound intensity varies from very soft to very loud. Okay, if you want us to perceive the soft sounds, you require this outer hair cells to be functioning normally. Okay, so these act as an amplifier. What happens? If there is a very soft sound, the vibration will be very less. So it has to boost the vibration. So this naturally acts as an amplifier and boost the vibration. Okay. The inner air cells act as a transducer, okay, a sensory transducer. It converts the vibration into electrical signal or a neural signal. Okay. Then the neural signals goes to higher centers. Okay. So in this, among these two, these outer hair cells are more vulnerable to damage, okay, due to anything, infection, trauma, any accident. So these outer hair cells are more vulnerable for damage. Okay. So what happens in the inner ear exactly? So you have outer hair cells that amplifies the vibration. Then you have inner hair cells that act as a transducer, convert it to neural signal. Then the neural signal goes to the brain for interpretation. Okay, if I ask something, you are able to understand that and reply to me because you are able to sense that sound and send that information to the brain for understanding. Okay. So just quick recap. So what is the role of outer and middle ear? We call it as conducting mechanism or conductive mechanism. Okay. Second, inner ear is sensory mechanism. frequency coded along the threshold base lab memory. So it is spanning from 20 Hz to 20,000 Hz. Then function of the outer cells, natural amplifier, cochlear amplifier. Okay. Then you have a inner cells, act as a transducer. Okay. So we move on to the, I just briefly talked about the anatomy because already you had gone through yesterday about the anatomy and other things. So I'll just tell about what are the different types of hearing loss, okay, where the hearing aid is recommended. Okay. So it depends, the type of hearing loss depends where the problem is. Okay. Whether it is in the outer ear, middle ear or inner ear or in the still higher structures. So hearing loss generally categorized as peripheral and central. Central means there is a problem in the brain structures or brain stem and all that. Peripheral is either problem is in the outer ear, middle ear or inner ear. One of them. Okay. So under peripheral you have something called conductive, sensory neural and mixed. Okay. As the name suggests, conductive means there is a problem in the conductive mechanism. Either problem in the outer ear or middle ear. Okay. Then sensory neural means the problem in the inner ear. So that is the sensory structure, right? The problem in the inner ear. Mixed is combination. There could be a problem in the outer or middle ear also, as well as in the inner ear also. Okay. So that's besides the type of hearing loss. So under sensory neural, it can be at the cochlear level, like coil-like structure, that level, or it can be at the nerve level. Okay. So that categorizes as sensory and neural. So if the problem is in outer ear or middle ear, it is called conductive hearing loss, and it's beyond this point, it is sensory neural hearing loss. Okay. If it is combination, you will have mixed hearing loss. So this tells about again the same thing, but if the problem is beyond this, we call it a central problem. Okay, if there is a person head injury, so there is some damage in the brain structures, so you will not be able to understand what we say. So that is a problem in the central structure. It is called central dysfunction. But whatever other type we discussed, it is conductive, mixed and sensory neural. Okay. So how to test? So we have to test the hearing and identify what type of hearing loss they have. So generally, hearing test is conducted in a sound treated room because we want to eliminate the influence of other environmental background noise and all that. So it is done in a sound treated room, and we use something called pure tone audiometry. So pure tone audiometry is we use a pure tone signal. Pure tone is a single frequency signal. We use that to measure our hearing ability. So we do the measurement in two different modes. One is called air conduction mode, another one is bone conduction mode. So air conduction mode is what normally we hear. Normally we perceive sound through air conduction. The sound passes through outer ear, then middle ear, then inner ear. Okay. So that is air conduction mode. Then we also have something called bone conduction mode. Okay. So bone conduction is the vibration is conducted from the bone directly to the inner ear. Actually, it bypasses the outer and middle ear. Okay. So that is bone conduction. So we assess the hearing in air conduction mode and bone conduction mode. Okay. Why we have to do this? Because normally we perceive through only air conduction. So why we have to do bone conduction is it helps to identify whether what type of loss. Okay. So in case of conductive loss, there is a problem in the outer and middle ear. Okay. Only the air conduction will be affected. Okay. Because bone conduction sound directly goes to the inner ear. Okay. So that's why it will not be affected in case of conductive hearing loss. So to differentiate the type of hearing loss, we do air conduction as well as bone conduction. So how we measure air conduction and bone conduction? We use headphones for air conduction. Okay. And we use something called a vibrator, bone vibrator. Okay. It vibrates, it converts the sound into vibration. Okay. So that vibration can go directly to the inner ear. Okay. So we use this transducer to check our hearing. we generally measure from 250 Hz to 8000 Hz. Okay. Even though we have very wider range, 20 Hz to 20,000 Hz, for understanding speech, you require 58 kHz only. Okay. So in that case, to assess hearing ability, we generally use 250 to 8000. We don't do very low frequencies because it is affected by the background noise. So there is some amount of background noise will be there. So that will affect your testing. So that's why we measure only from 250 Hz to 8000 Hz in octave frequencies. We have different octave frequencies: 250, 500, 1000, 2000, 4000, 8000. Okay. So we usually plot find something called hearing threshold. Hearing threshold means what is the minimum level we are able to perceive. Okay. Or minimum intensity level we are able to perceive. So that we measure for all the frequencies. Okay. And we plot that value in the graph called audiogram. This particular graph is called audiogram, where we have x-axis we have a frequency and y-axis we have a intensity. Okay. So generally normal hearing person will have values within 15 decibel. Okay. They are able to hear very soft sound also. Okay. So generally if the values are within 15, they are normal hearing. Okay. If the values drops down, then based on how much it is, they categorize into different severity of loss. Okay. There can be mild, there can be profound. Okay. So various categories are there. Okay. Generally anybody undergo hearing testing, so you will see the report will have these graphs. Okay. This is the audiogram. So we use a pure tone signal. We present through the transducer, headphones and bone vibrator to test the hearing. So the degree of loss usually classified, so as I mentioned, it is within 15, it's considered as normal. If it goes to 16 to 25, it's called slight hearing loss or minimal hearing loss. 26 to 40 mild, 41 to 55 moderate, 56 to 70 is moderately severe, 71 to 90 severe, and above 90 it is profound. Okay. So based on these threshold levels, we categorize them into different severity of the loss. Okay. So after the audiogram, we would have interpreted that audiogram and mentioned that the person is having moderate hearing loss or severe hearing loss like that. Okay. So as the thresholds drop so much, you see the severity is increasing. Okay. So more the severity, they will have more problem in understanding. Okay. So just give us some overview. What will be the consequence or in case the person is having hearing loss? The person is having minimal loss, so he will have problem only for soft sounds. Okay. If you speak normally, or if you they will not have any problem because their hearing sensitivity is affected slightly affected. So they will have only problem in the soft sound. In case of mild loss, if somebody talks from far, okay, so they may miss out or they may not be able to hear clearly, or somebody talk very softly. They will find difficulty in case of mild hearing loss. Moderate hearing loss, even when in case if you just stand in front of the person and speak also, they will have difficulty because their loss is higher. Okay. So generally our normal conversation we consider as 60 dB SPL. That is the level. Okay. So normally we speak at 60 dB SPL. If we raise our voice, the voice can go up to 80 to 90 decibel. If we speak softly, it will become 30 or 40 decibel. Okay. So moderate hearing loss will have problem in the distance and will also have problem in the perceiving soft sounds. So for moderate hearing loss, you require to provide hearing aid. Okay. Without hearing aid, they will find very difficult. Okay. Again, moderately severe, they will not be perceiving conversational speech. Only if you shout, if you speak very loudly, then only they will be able to perceive. Again, severe and profound are still higher severity. So actually they are only able to hear very loud sounds like any blast or any very loud sounds. Only they will be able to perceive. So as here, as the level goes down, we have greater severity, and here it is frequency. Again, so we have discussed type of loss, so conductive loss and sensory neural and mixed loss. Okay. So again, which frequency is affected? Based on which frequency is affected, you categorize them into different configuration. Okay. For example, somebody you see here is equally affected, almost equally affected. It's called flat hearing loss. Okay. So flat hearing loss, it is gradually sloping. Sloping means the high frequencies are more affected than the low frequencies. Okay. This is steeply sloping. Here you had a good hearing, but it drops down quickly. Okay. This is called raising pattern. Okay. Low frequency has more problem and high frequencies are better. Okay. This is like a Prof shape, U shape. Okay. And we have a notch like that. So these are the different patterns you will see. We call it this as a configuration of hearing loss. Okay. Because it tells how the hearing is affected across frequencies. For some people, the low frequency will be affected. Some people, mid frequency will be affected. For others, it will be high frequency. Okay. But generally, high frequencies are more vulnerable. Okay. Because of aging. Even if you take older adults, aged population, for them also the high frequency will start affecting first, then only the low frequency will get affected. Okay. So majority you will see the high frequencies are getting affected. So that is about the configuration, and also some of the terminologies what we use when we call it as unilateral loss. Unilateral means the loss is only one side. Okay, one ear is normal, only one ear is affected. Bilateral means you have loss in the both the ears. And you have, under bilateral you have symmetrical and asymmetrical. Symmetrical means the loss is equal between right and left ear, it is almost equal. Asymmetrical means one ear is better, the other ear is poorer. Okay. So because the management will differ based on the type, degree and configuration, and also these categories, whether unilateral, bilateral, symmetrical, asymmetrical, all that. So we also have something called congenital loss. Congenital means from birth they have a hearing problem. Okay, from birth onwards. So that is congenital. Acquired means they develop hearing loss at later life. Okay, if you in case of older adults, because of the aging factor, they have hearing loss. That is acquired condition. Okay, so initially they have normal hearing, but later life they develop the hearing loss. So that is congenital and adult. It's based on the onset, what time it occurs. Based on the time, for some people it will be sudden. So they are completely normal on the previous day and they suddenly develop hearing loss. Okay, that is sudden onset. Gradual means slowly it will deteriorate. So most commonly as the age increases, their loss will slowly deteriorate. That is gradual. Okay. Then you have based on the nature of hearing loss. There are some conditions can be progressive. You may have mild loss now, but after a few months or few years, it may go to severe loss. That is progressive. The loss is increasing. Then stable, when some people will have stable loss, same loss they have. Fluctuating means sometimes there will be a better hearing, sometimes there will be a poorer hearing. So that fluctuation will be there. So it's fluctuating hearing loss. So these are the terminologies you commonly see this. So a sloping configuration means the hearing is poorer in the which frequencies? Higher frequencies. In conductive hearing loss, the pathology in dash and dash. Conductive hearing loss, outer and middle ear. In case of normal hearing, which we consider normal, minus 10 to 15 decibel. Congenital means 5%. Asymmetrical means there are different severity of loss between right and left ear. So we will now move to actual what are the reasons, what are the causes for hearing loss. So what leads to hearing loss? Okay. So hearing loss is something which is not only seen only in the older population. It can be seen in just born baby, newborn, or it can be seen in older adults also. So across life, across different age group, there are chances that the person can develop hearing loss. Okay. So it can occur at any age. So there are multiple factors that influence. The first thing is a genetic factor. So genetic is an important thing. So there are a lot of genetic mutations that happens that lead to hearing loss. Okay, that leads to congenital hearing loss. The person develops loss from birth onwards. Okay. Then biological factor, your health condition. If you have any infection or if you have head injury, okay, all that can health condition. So that can also lead to hearing loss. Third is behavioral factor. Okay, nowadays we listen music at louder level. We exposed to noise, traffic noise, okay, or the person work in an industry where the noise is too high level. So that also can cause hearing loss. And environmental factor. Okay, so combination of all these, so I just categorize into these. The hearing loss can occur because of any of these reasons. Okay, there are some causes you can prevent them. Okay, you can control them. If you control them, the person will be prevented from developing hearing loss. So genetic cause, that is from birth, it is through the gene mutation. Okay. So under the genetic you have a syndrome and non-syndrome. Syndrome means the person will have multiple problems. So they may have problem in the kidney, they may have problem in the heart, they will have problem in hearing also. So that is called syndrome. Okay. So another one is non-syndromic. So they will be perfectly normal, only they will have problem in hearing loss. Okay. So that's what hearing loss is invisible. In case of non-syndromic, you will not know. The baby will appear normal, but there are chances that they can develop hearing loss. Okay. So that is purely genetic reason. Okay. Non-genetic, it could be infection or certain medication, noise exposure, or during birth there are some complications. So medical complications. These all can lead to hearing loss. Okay. That is non-genetic. Okay. So under genetic, it is contributing actually more than 50% of the cause is genetic. Genetic is the reason. And under that we have a non-syndromic 35%, syndromic is 15%. Okay. There are more than 250 genes are identified that can lead to hearing loss. Okay. So next, so during the birth, or this is before birth, if the mother get any infection, that infection can spread from mother to the developing fetus. Okay. So it can be acquired by the mother during pregnancy time, because during pregnancy the first 20 weeks are important. The first 20 weeks only your ear structures are developing. Okay. It is functional by 20th week. So 20th week actually the fetus can start hearing. Okay. So during that time, if the mother get any infection or something, it can lead to hearing loss. Okay. Congenital hearing loss. So there are various bacterial virus causes are there. Commonly it is known as torch infection. Okay. Torch is toxoplasmosis, syphilis, rubella, cytomegalovirus, and herb simplex virus. It's commonly called as torch infection. If the mother gets this torch infection, one of the infection, it can spread to the baby, fetus. Okay. That can lead to hearing loss. Okay. Among this infection, the cytomegalovirus is more common. Okay. So what happens? These virus or bacteria can arrest the development. So that's what the first 20 weeks are very important. If there is any problem, the ear structure might not develop properly. The air cells, what I discussed, outer air cells and inner air cells, that might not develop properly. So if that is not developed, the baby will have hearing loss. So next is the during birth. There is something condition called hypoxia or asphyxia, that is lack of oxygen. Actually, as soon as the baby born, the baby should cry. Actually, baby is crying means the baby actually breathing. Okay, if the birth cry is delayed or any complication is there during birth, that can lead to hypoxia. Hypoxia is lack of oxygen. There is no baby is not getting sufficient oxygen. Okay, so these oxygens are very important for the air cells. The oxygens are less is there, then air cells can damage. Okay. So it's a reduced oxygen supply, and and once the hair cells are damaged, it is permanent. Okay, it doesn't grow back. Once it is damaged, it is permanent. Okay, and it can lead to sensorineural hearing loss. Next is the hyperbilirubinemia, that is commonly called jaundice. Okay, jaundice, you would have heard about jaundice. So it's most common in babies actually. It generally comes when it's very mild symptoms will be there, it will resolve. But for some people it will be more severe. In that severe condition, so this jaundice can damage your brain structures for the nerve, auditory nerve, hearing nerve and all that. Okay, this is toxic to the nerves. Okay. So there is something called bilirubin. Okay, this bilirubin is actually excess bilirubin will be there in case of jaundice. You will see yellowish appearance of that. So these bilirubins are toxic actually. So actually generally your liver actually removes that excess bilirubin levels normally. In a babies what happens, this very immature liver. Liver is not fully functional. So in that case, if they have so much of this bilirubin, it is toxic to the nerves. It can damage the nerves. Next is the low birth weight. Okay, baby born with a less weight, less than 1.5 kg. Okay, that we call it as low birth weight. So generally, low birth weight, baby with a low birth weight will have other medical complications. Okay, so that can lead to hearing loss. Okay, so that thing. Then you have something called during childhood you may have any of infection like this, like cytomegalovirus. Meningitis. Meningitis is the infection, bacterial infection surrounding the brain. So they will have severe headache, vomiting. So that affects your hearing also. Okay. And if the baby is admitted in a neonatal ICU, baby is kept in ICU after birth for longer duration, it means that baby is having many medical complications. So that can also lead to hearing loss. Okay. So these are all in the young children. Have this complication. So during childhood condition, that period, you can have infection. So a lot of time the observed the person will have a discharge. There is a fluid discharge from the ear. That is actually the infection. It's called otitis media. Okay, it is actually affecting your middle ear. Okay, there is I mentioned that middle ear is air-filled structure. Because of the infection, it will be filled with fluid. Okay, that fluid is actually accumulating so much and it can damage your eardrum and it can discharge. So you will see person will have ear discharge, their fluid discharge from the ear. Okay, that is actually because of the infection. Then you will have measles. Now these are viral infections. Commonly you see during childhood, but these considerably reduced because of the vaccination. So you would have learned MMR vaccination. So because of those vaccinations, these conditions are now reduced. Okay. And most commonly is the earwax. Okay. Earwax is actually it's a protective in nature. It protects from insect entering the ear. Okay. It actually eliminates the dead skin cells and dust, all that. So it's normally produced and normally comes out automatically. For some individual, what happens? It produces in excess. More amount is produced. So for them, it can block your ear completely. When it blocks your ear, you will feel that your hearing ability has come down. So generally, what we do, we use earbuds. So actually, they recommended we should not use earbuds because we tend to push the wax inside. It is getting trapped here. Actually, your ear canal is not straight. Okay, it is like it goes up and it goes down. What happens with the earbuds? You try to clean, you are trying to push it up and it goes and settles here. Then removal is not possible. So you have to consult a ENT doctor for removal. So generally, if it is completely blocking your canal, yes, it can lead to hearing loss. So this condition is very common in children and older population. Okay. Their canal will be very narrow in case of children and older population. So that time slight wax production can block the ear. Okay. Once you remove the wax, they will have completely normal hearing. Then heteroma. due to fall, injury or slap. Somebody slap on the ear, there is a lot of pressure that can damage your eardrum. Okay. If you slap, don't slap it on the ear. Okay. So trauma can cause conductive loss also, or it can cause sensory loss also. Okay. If the outer or middle ear is affected, if it is a mild injury, then outer and middle ear are affected. If it is a road traffic accident, there can be head injury, so that can affect your inner ear. So that can lead to sensory impairment. Next is the noise exposure. So noise exposure, we are mainly in the big cities we have a lot of noise, and some of the individuals who work in a factory also exposed to very high level of noise. So this continuous noise of higher intensity we are exposing, it can damage your hearing. Okay. So generally these are the hair cells. So it is a microscopic view. This is outer hair cells and inner hair cells. This is normal. So why we call it as hair cells? Because the hair-like structure on the top of the cell. That's why we call it as hair cells. So this is a normal cochlea. If the person exposed to noise continuously, it can damage. See the hair cells are damaged here. And also most commonly now on youngsters, they listen music using earphones or earbuds continuously, and even on the noisy place. What happens in a noisy place when you use earphones? You will not be able to hear clearly. You tend to raise your volume. You keep it at maximum. So there is a lot of sound intensity that is going inside. So that can damage your ear. Okay, that is most common now in youngsters because of continuous use of earphones. Okay. So mainly this 12 to 35 years, there are 50% of at risk of developing hearing loss because unsafe listening. Okay. We tend to raise our volume. It's generally recommended you keep 60% of your mobile volume. Okay. If it is too noisy outside, try to move away from noisy place and use the earphones. Okay. Or use noise cancelling headphones. So that at least cut down some amount of noise so that you can keep the volume at lower level. Then there are certain medication that can also damage your hearing. So these medications are given for life-threatening conditions. Okay, so like the person is having TB, tuberculosis, and the person is having pneumonia, severe infection of lungs, or malaria. So those life-threatening conditions, there are certain medications like aminoglycosides, quinine, loop diuretics. These medications are given to treat life-threatening conditions. Okay, so these medications can damage your hair cells. Okay, so it is given based on the dosage. The higher dosage is given, it can completely damage your hearing. So they monitor the hearing during when they prescribe these drugs. Okay, they do hearing testing frequently and see how much hearing has deteriorated. Okay, but these drugs cannot be completely avoided because of these are used for life-threatening condition. Okay. Another most common reason is age-related hearing loss. Okay. As the age increases, the person start developing like any other organ. Your hearing also start deteriorates. Okay. Again, because of our lifestyle now, this age-related starts from 35 to 40 years. Okay. Again, it depends on your overall health. For some, you will see some person who is 70 years or 80 years may still have good hearing. Okay. It depends on your overall health condition and lifestyle and all that. But nowadays, with our current lifestyle, it is starting from 40 years. Okay. Gradually it deteriorates. Aging is a factor that degenerate your inner ear structures and neural structures and all that. So mainly it starts from the high frequency. Okay. So the deterioration starts from high frequency, then comes to the low frequency. Okay. So they will have problem. Most common condition, they will have difficulty in understanding speech. So they will say that I heard something but I am not able to understand what. Can you repeat? Okay. Or you may need to say 2 or 3 times to make them understand. Okay. So major complaint will be the difficulty in understanding. That is because of their brain structure also is degenerating. Okay. So over 65% of adults greater than 60 years experience some degree of hearing loss.
25% had moderate or higher degree of loss. So they required intervention, they required treatment. Okay. So this is being more common. So more number of older age individuals are getting affected to hearing loss. Even your nutrition deficiencies also can lead to hearing loss. Certain nutritions like zinc deficiency or vitamin A deficiency or iron deficiency. So these all also can lead to hearing loss. Okay, these are very important for normal functioning. The zinc and vitamin A is for your immunity. So if it is deficiency is there, you are prone to more infections. Okay. Similarly, iron is very important for your normal functioning of your nervous system. Okay. If that is iron deficiency is there, that can affect your neural structures. Okay. Nutrition deficiency also affects your hearing. Another chronic conditions like blood pressure, hypertension, diabetes. Diabetes affects your whole body, including your hearing. So because these hypertension or diabetes affects your blood circulation to the cochlea. Okay. If the blood circulation is affected, then your air cells will, there is some small interruption in the blood supply, your air cells will damage. As I mentioned earlier, once it is damaged, it's not reversible. Okay, it is completely, it's a permanent condition. Okay. So genetic causes, more than how much percent? 50%. Any two infections that leads to hearing loss? Touch infection. Easy to remember, touch infection. Otitis media, that's I told you, the fluid accumulation in the media. Impacted wax or impacted ear wax causes obstruction. What type of loss it will create? Conductive, because it is in the outer ear. Okay. Noise exposure, particularly which air cells are more vulnerable? Outer air cells are vulnerable. Next, now I just discussed about different causes. Just given an overview, I didn't go into detail. But these are the reasons. One will be the genetic reason. Another could be infection, various infection during birth, before birth, or after, during childhood time or adult age. Noise exposure is a very important cause. Certain medication can cause hearing loss. Certain medical condition like diabetes, hypertension can cause hearing loss. Nutrition deficiencies can cause hearing loss. Okay. So I just listed out some overview of different causes that lead to hearing loss. Okay. So do you have any questions? Can I move further? Yeah. You should not put oil or any water, oil or anything. So ideally, as I mentioned, wax is the normal, it will produce and it will, while sleeping it will fall off. Small quantity it will fall off. Okay. For some individual, the excess production will be there. For them, ideally you have to consult an ENT specialist where they give a drops. I think it will soften your wax. Initially it will be very hard to remove. So it is not recommended you use any sharp object or earbuds, okay, or pin or anything to clean. So it is a normal process, it automatically self-cleaning process is there. It automatically cleans itself. Okay. For individual who have excessive production, for them, you have to consult the ENT doctor. With the drops, it will soften the wax and it will automatically fall off. Okay. So always good advice is keep your ear dry. Okay. Even after bath, water is entered, try to clear it. So if you keep your ear dry, less chances you will get infection. Okay. So what are the management? What are the treatment for conductive hearing loss? So in conductive hearing loss, the problem is in the outer and middle ear. The function of this outer and middle ear are conducting the sound. Okay. Other than that, it's not sensing the sound. Okay. So generally, you treat the underlying causes. Okay. If there is an infection, you treat that infection. If there is a wax accumulated, you clear the wax. based on the underlying cause, your treatment will be based on that. Okay. So in case of surgery may be required, in case infection or there is a rupture or there is a hole in the eardrum, then they do a surgery. Okay. So generally, in conductive hearing loss, majority it's medical or surgical treatment. Okay. Okay. These two things are recommended. But for some individual, even after medical or surgical treatment, some amount of hearing loss will be there. It will not completely recover. Okay. For them, you recommend hearing aids. Okay. So because conductive loss, it blocks the sound conduction. Okay. So the person will have problem in listening soft sounds. So your hearing aids, what it does, it amplifies the sound. Okay. So for those individuals where medical or surgical treatment is not sufficient, for them you recommend hearing aid. Otherwise, initial line of treatment is medical or surgical. Okay. For conductive loss. So generally, there is their inner ear is normal. In conductive loss, what happens? The inner ear is normal, which is a sensing structure. Okay. So they generally do well with the hearing aids. They do very well with the hearing aids. With the hearing aid, they are able to understand better. Okay. So that is about conductive loss. We move to the sensory neural loss. So sensory neural loss, the problem is in the inner ear, the coil-like structure. Okay. So that is the sensing organ. So if there is a problem, then it will affect their perception. Okay. So again, it varies from different degree of loss. Okay. For normal, you have normal air cell function. For mild loss, there is some amount of outer air cells are damaged. Okay. They may require hearing aid, okay, for perceiving the soft sounds, mild hearing loss. If you go to moderate or moderate severe or severe, so their air cells are completely damaged. Okay. They also require hearing aid. Hearing aid is recommended. Okay. Again, if they are severe or profound hearing loss, okay, again severe and profound hearing loss, they don't do well with hearing aid. So for them, you have something called cochlear implant. So that is again, you do a surgery and place the device inside the cochlea. So that is, I'm not going to detail that. Generally, the hearing aids are recommended from mild to moderately severe. Okay. So that is, they are good candidates for hearing aids. So these two cells are very important, outer ear cells and inner ear cells. This is acting as an amplifier. This is the transducer. Okay. So this is more vulnerable. So for getting damage. So generally, if there is complete loss of outer ear cells, the loss can go up to 50 decibel, around moderate degree. Okay. Whereas if the loss is beyond moderate degree, it means that there is some amount of inner ear cells also damaged. Understood? So if the loss is less, it is purely outer ear cells are damaged. If the loss is higher, then it is combination. Outer ear is also damaged, inner ear is also damaged. So generally, hearing aid, what it does, it mimics the function of outer ear cells. Okay, outer ear cells, actually I told it's amplifier. So similarly, your hearing aid also is amplifier. Okay. So hearing aid is functioning as a outer ear cells. That is the main. You are trying to replace that. If there is a damage, you are trying to replace that with the hearing aid. Okay. So hearing aid also does the amplification. It boosts the sound. Okay. So mild to moderate or moderate severe, they primarily OIC loss is there. They are good candidate. They get good benefit from the hearing aid. If the loss is beyond that severe or profound, then even though you fit the hearing aid, they don't understand well because the loss is so much. Okay. So this tells again normal and damaged cells. Okay. So hearing aid primarily compensate for the outer ear cells, okay, which is an amplifier. Your hearing aid also is amplifier. So always remember, hearing aid is do not replace the normal function. Do not restore the normal hearing. Okay. If the person is wearing hearing aid, it's like your spectacles. If you wearing it, you will be able to see. If you remove it, you will not be able to see. Something like an hearing aid, whenever they are wearing, they are able to hear all the sounds. If they remove it, they will not be able to hear. Okay. So if the hearing loss is not treated, okay, so what are the consequences? Okay. In case of children, as I mentioned, starting only with the hearing only, the baby starts learning speech, how to speak and all that. So that will be affected. Okay. So it affects the speech and language development. Okay. It affects the psychosocial well-being, quality of life. In case of adults, quality of life. In case of children, it affects their education. Okay, education. In case of adults, it affects their employment, job performance, all that. And also economic independence will be affected. The person, the child is affected with hearing loss. If it is not treated, then the child will not be able to speak. Okay. So throughout life, actually, the effect will be seen. Okay, they are not completely independent. They are always have to be dependent on others. Okay. So that's why it is always recommended. We have to identify the loss and treat them as quickly as possible. Okay. So now we have facilities. Actually, you can test the newly born baby. You can test the hearing. Okay. Because I told your hearing system is developed by 20th week only. Before birth only it is fully developed. Okay. It start functional also. Okay. The baby, the fetus can hear actually sound. So you can test soon after birth. The baby hearing can be tested. Okay. So conductive hearing loss primarily affects what it affects actually. Conduction of the sound. Okay, that is affecting the conduction of the sound. Sensory neural, usually dash and not reversible. It's temporary or permanent. It's permanent. Most of the conditioning is permanent. Then loss of OHCs can go up to how much dB loss? 50 dB loss, a moderate loss. When hearing exceeds 60 or 70, dash damage is added. Inner air cells also is damaged. Hearing aids primarily compensate for loss of outer air cells. Okay, it is acting as an amplifier. So we'll see what are the. So generally, among this conductive or sensory neural, conductive loss will not have any problem in understanding speech. Okay, if you speak loudly to them, or if they wear the hearing aid, they just need sound need to be amplified for them because there is a problem in the conductive mechanism. So they generally do very well. They don't have problem in understanding. Okay, they will be able to understand very well. But when it comes to sensory neural hearing loss, where these hair cells are damaged, so there are multiple problems. Not only hearing, also understanding. Okay, so the entire processing is getting affected. Okay? Your ear is actually process the sound and send the information to the brain. If the whatever signal is sent from ear to the brain is distorted, then you will not be able to perceive better. Okay. So the sensory neural hearing loss causes a lot of distortion to the sound. Okay. So it will not be clear for them to hear and understand. So what are the consequences if you see? There is something called decreased audibility. Okay. They are not able to listen to soft sounds. So that is a major complaint. If you ask somebody or some patient comes for the hearing testing, what are problems? If you ask, they say that I'm not able to hear soft sounds. Or if somebody calls, speak from far, I'm not able to hear. Or I ask for repetition, I'm not able to understand what it is. Okay, when there is a lot of background noise, I'm finding very difficult in understanding. So those are the common complaints you will see. Okay. So what is the decreased audibility? So they are not able to perceive soft sounds. Okay. And abnormal loudness perception. Okay. Their perception is completely affected. Okay. So we are able to hear from very soft, very faint signal to very loud signal. So we have a wider range of intensities we are able to perceive. Okay. Whereas in hearing loss, that loudness perception is affected. And third consequence is frequency selectivity. So they are not able to discriminate different frequencies. Okay? Because the frequency discrimination is important for understanding speech. Okay? If the frequency discrimination is affected, the person will find very difficult. Okay? Then we have temporal resolution, that is how the processing of rapidly changing time aspect is also important for understanding speech. So, the person is having sensory neural hearing loss, there could be a problem of audibility, problem of loudness perception, problem of frequency discrimination, problem of perceiving the time information. Okay. So, what is the decreased audibility? So, they have problem in soft sounds. If you amplify the sound, they will be able to hear. Okay. So, sounds must be louder to be heard or understood. Next is, so they have reduced sensitivity to soft sounds or weak sounds. For them, you need to increase the intensity. You need to amplify the sound, and it affects the speech understanding. Okay, and mainly they have problem in the high frequencies. Okay, the high frequencies, these are the sounds. There are many sounds actually. Just give an example. These are the sounds as energy in the high frequency. So, those sounds are having energy in the high frequency. If the person is having a problem in the high frequency, they will not be able to perceive these sounds. Okay? If you say school, they will perceive as cool. The sound is not perceived. Okay? So that problem is because it's not audible.
So audibility is dependent upon the medium where the timing changes like season, winter or summer, and particular.
But no, this audibility depends on amount of loss. They have mild loss or moderate or
Talking about the medium. Medium. Audibility is dependent upon the winter or summer seasons. Some over the age-related people.
In winter season, they most often get cold, infections or all that. So that time they may have, the sound conduction will be affected. Otherwise, the loss of audibility is mainly depends on how much loss they have. Okay, they have mild loss or moderate or severe. Okay, for severe loss person, you have to extremely scream, then only they will be able to hear. If you have mild loss person, if you slightly speak louder, they will be able to hear. So that audibility depends on the severity of loss. Okay. So mainly the high frequencies are affected, they miss out some sound actually. So this is, I just want to simulate the hearing loss. Okay. Audio is there. So this is actually the person is having 30 dB loss. It's like a mild loss. And this is actually severe loss, 80, 85 on that severe loss. And this is actually having problem with the high frequency. So they have good hearing in the low frequency, but high frequency is affected. No, we can hear for 20,000 hertz. Okay. No, if they are very young, they will be able to hear even 10,000 hertz, 20,000 hertz. But generally, what happens? The age-related starts from high frequency. So for speech understanding, you require 80 kilohertz. That is why we test this, why we consider this frequency, because it is important for speech understanding. Okay. So for this problem, for a mild loss, they will hear softly everything. You may speak normally, but what they perceive is like they will feel very soft. This is severe loss, they will not be able to hear anything. So when I talk at a normal level, they will not be able to hear. When I speak very loudly, they may hear something. Okay. In case of severe loss. Here, it's called sloping loss. The problem is in the high frequency. They miss out some high frequency sounds. So clarity will be affected. So that is about the audibility problem. So your hearing aid solves that problem. Okay, because it amplifies the sound. Okay, so hearing aids as an amplifier that amplifies the sound. So it tries to solve the problem of audibility. Okay. Next problem is dynamic range, decreased dynamic range. So we are able we have more than 100 dB dynamic range. Okay? So generally if I present 120 dB or 140 dB, it will be too much, it will be painful. We call it as uncomfortable level. Okay? And mainly, that's why you might have seen in the airport they will be wearing the hearing protective devices when they are near the flight. It produces a lot of noise. It can go up to 140 decibel. So those levels, it is affecting the hearing. In case of hearing loss, this is normal where we have wider dynamic range. In case of hearing loss, what happens? Their soft sounds are not perceived. Okay, so this is getting affected. But the loud sounds are too much loud for them. Okay. So their loudness growth is affected because their thresholds or their audibility is increased. Okay, the level, see here it was here audibility. Here the audibility is increased, but the growth of loudness is increasing. For loud sound, they are finding very discomfort. Okay. So the dynamic range is this much only here. Whereas you have dynamic range here, very wider in case of normals. In case of affected people, the dynamic range is less. Okay. Next is a decreased frequency resolution. So when you tell about any monitor or anything, we talk about resolution of the monitor. So if the resolution is poor, then you will not be able to see the message or see the visual clearly. Similarly, your hearing also, sound also has different frequencies. So we need to differentiate this frequency. Otherwise, the clarity of the speech will be affected. Okay. So in case of hearing loss, this frequency resolution is affected. Okay. The frequency, they are not able to differentiate two different frequencies clearly. Okay. Your speech has different frequencies. Okay. The speech has different sounds. There are some sounds are low frequency, some sounds are mid frequency, some are high frequency. Okay. If you want to say pa, ba, so pa and ba has to be differentiated. Okay. If you are able to differentiate pa and ba, it means that you are differentiating the frequency. Okay. So that is being affected in the case of sensory neural hearing loss. Okay. So mainly they perceive it as blurred speech. Clarity will be affected. Okay. So they will have difficulty, for example, these two different frequency. Okay, this is on the baseline membrane. So for a normal person, it will create two different perception because they are two different in frequency. But in case of affected with hearing loss, they perceive it as a single frequency. So the red color one is they perceive it as single frequency. This is the spectrum. Okay. So these are one frequency and these are the other frequency. But when they perceive it as they perceive it as combined to one. We will not differentiate the two. They two are different. Okay. So that is because of the affected frequency resolution. The other aspect called temporal resolution. Okay. If you take any complex signal or any speech signal, you will have something called envelope, that is a slow varying signal, and you will have fast varying signal called fine structure. Okay. These two are important. These two are give different cues for understanding speech. Okay. So what happens? This envelope is sufficient to understand speech. Okay. For normals, for example, if you do a Hilbert transform and remove the fine structure, you can actually separate the envelope and fine structure separately. Okay. Once you present only the envelope, for a normal hearing person, he will be able to understand everything in quiet. Okay. Because it carries all the information of the speech. The red color one carries all the cues for the understanding speech. But when it comes to noise or music perception, you require that fine structure. Okay. That fast varying signals, you require to perceive that. Okay. It is very important for speech perception in noise and music perception. Whereas the envelope is sufficient for speech in quiet. In case of loss, this coding complaint will be, I am able to hear very well in the quiet, but when there are group of people are there or when it is very noisy background, I find very difficult to understand. So that is the most common complaint you will encounter, because your hearing aid is not completely able to restore the normal hearing. Okay, so they always find difficulty in hearing in the presence of noise. Okay, so these are the major problem the person encounter. So reduced audibility to hear soft sound is called decreased. Name of that, decreased audibility. Okay. The difficulty in separating the similar frequency is called reduced dash resolution or frequency resolution. Poor processing of rapid acoustic changes, time information, time resolution or temporal resolution. Then temporal frequencies are important for speech in presence of speech understanding in the presence of noise and music perception. Okay. So individuals will often complain that difficulty in understanding speech in the presence of noise. Okay. So I just compare what is the problem, how hearing aid compensates for that. Okay. So for example, there is a reduced audibility. Okay, that is a problem. So what your hearing aid does? Your hearing aid does amplification, and it not only amplifies all the sounds equally, because if some person have problem in high frequencies, it amplifies more compared to low frequencies. So it gives a frequency specific gain. Okay, if the low frequency is less affected, it will give less gain. High frequency is more affected, it will give more gain. So that is called frequency specific amplification. Okay. And it also has something called compression, wide dynamic range compression. So as I mentioned, they have hearing loss individual will have problem only in the soft sound perception. So they will hear loud sounds normally like us. Okay. So this compression is mainly boost the soft sounds and keep the loud sounds comfortable to them. Okay. It applies something called compression. Okay. So loud sound should not cause any discomfort for them. So it compresses the level so that it doesn't cause any discomfort. So these two mechanisms is used in the hearing aid. One is frequency specific amplification. Second is compression. So these two are used to overcome the problem of audibility. Okay. So in this aspect, it is very successful in overcoming this problem. When we move to the next, abnormal loudness growth uses the compression. Okay. So automatically, see, for loud sounds you need not amplify. Okay. Only hearing aid to amplify soft sounds. Okay. And moderate level sounds. We need not amplify the loud sounds. Okay. So what it does, it gives a automatic gain control. Okay. Automatic gain control means whenever there is a soft sound, it will amplify. If there is very loud sound, it will not amplify. It will directly send the signal. Okay. No need of amplification. Okay. Is it clear or too much confusing? Okay. So because in hearing loss, they have problem in perceiving the soft sounds. So only that you need to amplify. Okay. So that is about loudness perception. Next is the frequency resolution. Okay. Again, frequency resolution is affected. Your hearing aid does not completely compensate for that, because in hearing aid you have something called multiple channels. Okay, you also have something called noise reduction technologies. So noise reduction, trying to reduce the background noise and so that the person can hear speech better. But the problem is if the background noise is speech itself, it means that you are speaking in a group of people, there are a lot of other people are also talking simultaneously. So, but you are listening to one person, so that is your target speech, remaining all your background noise. Okay. So your noise reduction actually very successful in constant noise like AC noise, fan noise. So it is able to suppress those noise. But when the speech itself is acting as a noise, then it will not be successful. If there are a lot of people are talking, then you
you are focusing on one person, then you will find difficulty in understanding. Okay. So that's your hearing aid use something called noise reduction technologies to cut down the noise, but that is constant in nature, the fan noise or AC noise or something. Then reduce temporal resolution. You also something called fast acting compression. Okay, you use a fast acting compression or binaural synchronization. Binaural synchronization means your hearing aid one hearing aid is communicating with the other hearing. Okay, it works together. Okay. Normally we have 2 ears, right and left ear. Actually both work together. Okay, it doesn't work independently. So what are the advantages? Because we have 2 ears, it has advantages. So 2 ears we are able to get, we are able to identify from which direction the sound is coming. If somebody calling you, you are quickly turning, they are calling from back, you quickly turn to the back because you know that sound is coming from back side. Okay, our sound is coming from the left side or right side. How you are able to identify? Because you have 2 ears. So your brain actually compares the sound, the input from the right ear and input from the left ear, and it compares based on that, it decides from which direction it is coming. From right, left side or right side or front or back. It gives a clear listening if you listen from both ears. Actually, the speech understanding is better if you listen from both ears. Okay, and in the background noise. So these are the advantages if you listen from 2 ears. One is speech understanding, sound localization, better sound quality, and it reduces the effort. It need not strain so much to understand. Okay, when the person is hearing from only one ear, he has to strain so much to understand. He is completely dependent on one ear. Okay, when the person is listening from 2 ears, there are 1 ear you will get better signal to noise ratio compared to the other ear. So, if, for example, one person the left side is clear for that, you will focus on the left side. Okay, so that is the advantage. You will have reduce the effort. You need not strain so much to listen. There is something called listening effort. Okay, compared to normals, like we generally easily listen and understand everything. But individual with hearing loss, they have to strain so much, they have to pay attention so much to understand. So their effort will be more. So these are the advantages of when we listen from 2 ears. So if the person is having hearing loss in both the ears, ideally they have to use the hearing aid on both the sides. Okay. If they use, there will be better speech understanding in noise, localization, listening comfort, reduced effort, overall sound quality will be better if the person is using hearing aid on both the sides. And now current technology hearing aids also has a wireless communication. It communicates from one side to other side. Okay. And it gives a more balanced sound. Okay. If you listen from both the ears, you will get more balanced sound. That are the advantages of binaural hearing. So again, speech perception with the hearing aid are affected by multiple factors. For example, I just list out some of the factors. One is the environmental factor. Okay, distance can affect your understanding. If somebody talks from far, from than close, because every doubling of distance, there is a reduction in the intensity. Okay, so distance can be competing talk. There are multiple people are talking simultaneously. Background noise. Okay, reverberation. There is a reflection, echo is better. The reverberation is there. That also can affect your speech. Okay, and somebody speak very fast. Okay, that also can affect. Somebody speak very fast, it will find difficult to understand. That is environmental factor. Then your hearing aid also cause some amount of distortion. Okay, because of the processing. So that also can cause distortion. Your environmental factor can cause distortion. Your hearing aid itself can cause distortion. But that distortion is considerably reduced now with the modern hearing aids compared to the earlier days with analog hearing aids that cause a lot of distortion. Okay, the modern hearing aid, the amount of distortion has come down. Third factor, problem with the person itself. Okay, the problem in terms of their processing of the sound. That itself is affected, then that also will affect the perception. Fourth is the cognitive load. Okay. If you pay attention more, it will be easy to understand compared to if you don't focus more. Mainly, normally what we do in case of a lot of background noise is there. When you are listening to one person, you try to pay more attention. Okay. So that if you don't pay more attention, then you will find difficulty in understanding. The same old goods for individual with hearing loss. So their cognitive load is increasing. Okay. So these four factors can affect. Okay. Next, so overall, if you see hearing aids, it restores the audibility. It makes the weaker sound to be audible, and it improves the communication. Okay. With hearing aid, they are able to communicate. They are able to listen. They are able to communicate, and it improves the quality of life. Okay. So they are able to mingle with everyone because they are using of hearing aids and providing improvement, functional improvement. Okay. So with the hearing aid, they are not able to function like others. Okay. So these are the benefits of hearing aid. Okay. Majority of them get benefit. Okay. But if you take how much in India, if you just take how many people are having hearing loss and how many people are using hearing aid. Okay. That is called hearing aid uptake. How much are willing to take hearing aid and use hearing aid. Okay. So even though it gives very high satisfaction, they are able to hear well with hearing aid. It improves their communication and quality of life, but it is very less people are accepting or using the hearing aid. Okay. The hearing aid adoption is remain very low to 1.4 to 2.3% of public usage, and less than 10% of those who need hearing aids actually use them. Okay. So 1/10 of population only uses the hearing aid. The reason could be multiple factors like social stigma. Nobody want to show that they have hearing problem. Compared to the vision problem, the spectacles are more accepted now compared to the hearing aid. So that is the social stigma preventing them. They don't want to show to others that they have hearing problem. Okay, that's one of the reasons why less people are using hearing aid. And sound quality, noise issues. Most of them find difficulty in understanding speech in the background noise. That is a major complaint. If you not address that, they may feel that they may buy hearing aid, but they say that I'm hearing only noise. I'm not able to hear clearly. Because they always compare with the normal hearing. So they had a normal hearing initially and they developed hearing loss. So after hearing aid, it is not completely natural hearing. Okay. So there will be some amount of distortion. So in that case, because of that, they may not use it. They may feel that it doesn't give benefit. Next is the cost. In India is the most important factor, affordability. Okay. The mindset of our older adults in India compared to Western countries. So in India they feel that I am aged already, what should I use? I'm okay, I will live with it. Okay, that kind of attitude we have. So the cost is the important factor. In other countries it is covered under insurance and all that. In India it is, they have to pay. So cost is an important factor. Cosmetic concern. Cosmetic concern is considerably improved now. Because earlier we used to have bulky hearing aids, big size. Now we have very small size which is not visible. So the cosmetic concerns. And mainly in the older adults it's visibility, noise problem, speech perception and noise, cost. So these are the barriers for the person to use the hearing aids. These are the different barriers. So actually we need to come up with affordable technology and improved service delivery. These are two important factors. Okay. For a better use of hearing aids. There are a lot of people actually who really require hearing aid, but they are not using it because of various factors what we discussed. So I just, because you are going to learn about current hearing aid technology or that, I just briefly go to it. So with the modern hearing aids now they more into AI driven technology, they incorporate in the hearing aid where it actually optimizes the setting. For example, when I'm here in a quiet situation, there are certain settings are there. When I quickly move to a noisy place, the hearing aid automatically changes the setting. Okay. It Then wireless connectivity. So now we are very easy. The hearing aid can be connected to the mobile phones. They can listen music, they can watch video in the mobile, they can talk over phone using wireless connection between the hearing aid and the mobile phones. And you can control everything from the mobile app. You want to raise the volume, you want to change the settings, all that is possible with the wireless connectivity. You also have smart sound processing. It knows that your hearing aid learns which environment you are. Whether you are in quiet, whether you are in noisy place, whether you are listening music. Okay. All that it senses that which environment the person is there. Based on that, it will adopt the particular settings for that. That is smarter sound processing. You also have, nowadays they try to incorporate tracking and all in the hearing aid. Okay, health tracking and all that, activity tracking. It also has a motion sensor where it detects the person is falling or not. So those kind of technology also they are incorporating in the hearing aid. Okay. So these are the current ongoing technology that is there in the hearing aid. Questions? When I said AI algorithm, it tries to sense, for example, if it is music, it will sense in the surrounding there is a music. It will go to a music program. If it is a noise, it will check if the constant noise is the fan noise or AC noise, it will sense the noise. It will change the directionality of the microphone. If the noise is coming from the side, your microphone will focus only on the front. Okay, so that the person will be able to hear clearly, trying to cut down the noise. So we have different microphone technology also. We have something called directional microphones, which focus on particular direction. Okay, that all automatic now. Earlier, manually they have to change the program. So for example, when we fit the hearing aid, also we give that use this program in quiet, use the other program for noisy please. Now it is more automatic.
Tracking is infringement of rights.
There are some people who will just listed out what other technology available. Again, it's individual specific. Do you want to recommend that for someone? It is up to the person need. So if some older individual, it will sense there is a chance of fall. So all that it will elderly people,
we want to monitor remotely. So if they are walking in the park, you are in home, you want to monitor that person and walk. So if any sudden falling down and any that kind of
I'm just saying that they trying to add the technology in the hearing aid. That's all. It is very useful or not. The person has to decide whether that particular technology is useful for him or not.
Sir, you already told that the earbuds what we are using nowadays, even almost all they are using without knowledge of that. Means that is a wrong practice actually.
Your ear has self-cleaning